I'm Niels Johnsen. I'm an assistant professor of urology at Vanderbilt University Medical Center. I treat men's health and reconstructive urology issues. Peyronie's disease is an acquired curvature of the penis that happens often for idiopathic reasons, sometimes related to an injury, that causes some deformity or bending or curvature or malformation of the erect penis. Most patients who develop Peyronie's disease don't really have a history of anything that predisposed them to it. Some people have things like Dupuytren's contracture, where you get some fibrosis of your hand, but most patients don't have any history of anything that predisposes them to Peyronie's, and it just pops up kind of out of nowhere. Usually you haven't done anything that's caused it. Sometimes you have little traumas that have occurred over the years, but most of the time it's what we call idiopathic, and it just appears kind of out of the blue. Patients with Peyronie's disease have a lot of options nowadays for treating their curvature. These range from everything like medications to injection therapies, traction devices, or even surgical intervention. And when you're seeing a physician trying to talk about what your options are for Peyronie's, we really individualize our treatment to the individual patient. Not everyone with Peyronie's disease has to be treated. We really kind of tailor our treatment to your quality of life. So if you feel like your curvature or your deformity of your penis is interfering with your quality of life or your ability to have satisfactory sexual activity, then that's something we want to help you with whatever form of treatment is right for you. People with Peyronie's disease can present with a spectrum of deformities or abnormalities of the penis. Sometimes early on, people will notice some pain with erections or even pain without erections. Usually that pain resolves kind of as the disease progresses. But people can present with various degrees of curvature in almost any direction. They can feel lumps and bumps on the penis, or even have sort of hourglass deformities or indentation deformities that make intercourse or sexual activity difficult. Patients who develop new penile curvature can be very concerned about it, and so the best thing that you can do is talk to a sexual medicine provider or a urologist who specializes in men's health to discuss what your options are and kind of see where you stand on that Peyronie spectrum and see what options are available for you.